Hello. Welcome to Module 4. This chapter will be the continuation of Module 3. Please watch Module 3 before watching this video. Let's continue our lesson on risk factors of cervical cancer. Sexual history. One's sexual history contributes greatly to increasing the risk of getting cervical cancer. For example, becoming sexually active at a young age, involving sexually with many partners, and having one partner who is infected by HPV. Having multiple full-term pregnancies. Women who have had 3 or more full-term pregnancies have an increased risk of developing cervical cancer. Studies suggest that hormonal changes during pregnancy possibly make women more susceptible to HPV. Family history of cervical cancer. Cervical cancer may run in some families. If any immediate family members such as mother or sister have cervical cancer, the chances of developing the disease are higher. Let's look into some ways to reduce the risks of getting cervical cancer. Get routine screening as recommended by your healthcare professional. Screening test helps in detecting precancerous cells that may develop into cancer. Before taking these tests, contact your doctor and choose the schedule that works best for you. Let's discuss the types of screening tests offered in both public and private clinics. Pap smear test. A screening procedure that checks for abnormalities in cervix. You are eligible if you are 25 to 29 years old or more, have engaged in sexual intercourse or have been sexually active. Do consult your doctor for more information. An HPV DNA test may be done during a pap smear to determine if you are infected with one of these high-risk types. Your doctor may recommend it, if you obtained an abnormal result or, along with a pap smear test aimed at particular age groups. Visual inspection with acetic acid can be done using the naked eye or with low magnification. This test determines if the result is positive or negative for precancerous lesions. Women between the ages of 30 and 50 can uptake it with recommendations. Liquid-based cytology, also known as thin prep, is a screening technique that inspects cells by dissolving them in liquid to detect high-risk HPV and low-grade cervical changes. It is suitable for the age group under 30, and also 30 to 50 years old. Another way to protect yourself from cervical cancer is by getting yourself vaccinated. The vaccines protects against certain types of HPV genotypes. In Malaysia, there are 3 vaccines made available: Cervarix, Gardasil 4, and Gardasil 9. Here are some of the facts on vaccination. Females of all ages can consider getting vaccinated upon a doctor's recommendation. The vaccines are most effective before a woman is infected with the HPV virus, and it is not a substitute for screening. Finally, we have reached the end of the lesson. Thank you. See you again in another lesson. Don't forget to complete the quiz questions.